Ni hao, and welcome to the Medical Protection Podcast. I'm your host, Dr. Katie Grant, and today I'll be talking with one of our many experts we have ready to present at the Spotlight on Risk Hong Kong Medical Conference. The conference runs from 2 until 4:15 in the afternoon local time on June the 25th. In case you're wondering what it will cost you, just 2 hours of your time. There's no fee to attend the conference, and this applies to both members and non-members of medical protection. So I encourage you to block out that time now and register using the link in the podcast description below. Now today we're joined by none other than Dr Bonnie Cheng. Dr Cheng obtained her PhD degree in Organisational Behaviour and Human Resource Management from the Rotman School of Management at the University of Toronto. Her research is dedicated to helping employees achieve and maintain well-being in the workplace. This includes understanding how and when workplace anxiety can enhance performance, recovering from daily job demands, and maintaining proactivity in the workplace. She has published in many journals, such as the Academy of Management Journal, the Journal of Applied Psychology, and Journal of Personality and Social Psychology. Her research has also been featured in leading media sources, such as the Wall Street Journal, Forbes, the New York Times, and the Harvard Business Review. Bonnie, it's wonderful to have you with us today.
Oh, thank you for having me. I'm thrilled to be here.
Great. And I wondered if you could start by telling us a little bit about yourself and how you ended up working in this fascinating area.
Yeah. So, now I like to tell people that I was studying, well-being and mental health long before it was, a hot topic. So, I think early on in my graduate school career, I was studying social and personality psychology. That led to an interest in how to apply these kind of social psychological frameworks and principles to the workplace. All of my conversations that I was having with people, when I started to go to graduate school, and all of my friends who were starting to work, always centered around their work stress. And that was also long before the COVID and the pandemic.
Yeah.
All of that also centered on, they were asking me about strategies and how to kind of recover and recuperate and manage their work stress. And I was telling them about, these principles that we would learn in class at the time to help them. But I realized that that wasn't really made transparent in the business world.
Yeah.
And so when I started my PhD in Rotman, which is a business school, I was really kind of linking the two, the social psychology with the organizational behavior studies of, business principles. And so that kind of led to this really, deep focus on workplace anxiety.
Yeah.
I was working with my supervisor who was very focused on anxiety from kind of an HR perspective. She was looking at, anxiety in job interviews and in a selection context. But I really wanted to bring that to, just, work in general, because we know that people are facing anxiety very much so on a day-to-day basis. That became, very salient, very timely, very relevant during the pandemic, when suddenly companies are reaching out to me saying, well, we are facing, this second pandemic or this epidemic of anxiety and stress. How do we deal with it? And you can imagine, going from Canada to Hong Kong, where, stress has been something that has, been, part and parcel to people's work lives, that has really escalated. And so some of that research has been, around culture, around organizational culture, and all of these kinds of contextual factors that have really amplified the work.
Amazing. I'm interested by the fact that your friends were asking you for advice, because I think certainly amongst my colleagues who are still working in medicine, it seems to be the thought of how do you recover. If I ask one of them, how do you recover, or what do you do in your time off, they probably haven't really ever thought about it. So the stuff you've learned and you've applied in the business sort of sector, are there carryovers that you can use in medicine? So are there ways that we can help our doctors and our dentists to recover effectively?
Yeah, absolutely. And I think that's the wonderful thing about research, and it's also the wonderful thing about studying organizations, because, hospitals, certain contexts, healthcare, those are industries. And so we're not limited to, just the corporate sector. We're not just limited to studying private or public sector. All of these, especially this topic of work stress, crosses industries, it crosses, various jobs, careers, all of these kinds of wonderful contextual variables that kind of guide the research. One salient factor, especially for healthcare professionals, is the fact that they find it very difficult to kind of plug out, right? This is something
Yeah.
that follows them. It's really, you don't really have the 9 to 5 in the office.
Yes.
You go home, you're not thinking about it. And especially with the pandemic, it's something that follows you home.
Yeah. All
That's the
encompassing.
same with
Yeah.
academia, right? So
Yeah.
for us, we're constantly thinking about our research or our teaching or whatever it is. And so some of the principles that we're drawing from now when looking at recovery is really around not specific activities that we do to recover, but kind of the underlying psychological experiences. And one of the main psychological experiences that research is demonstrating to really affect in a positive way our recovery is this idea of psychological detachment, which means regardless of the type of activity that works for you, right? Because yoga might work for you, but for somebody else, it's the worst thing you could do. The underlying that is the fact that you're cognitively taking a step back as well.
Yeah.
So there's the physical, but there's also the mental component, and it's giving both of them kind of this opportunity to switch off, right? Like a battery to recharge.
I think you've hit the nail on the head. I think, I'm sure I'm not alone in amongst my colleagues who have woken up in the middle of the night and actually rung the ward and checked that I've done a job. I had that all the time. And even my job, which was anesthesia, where you have almost got, you've done a list, patients have woken up, they've gone home, they're fine. Actually, even in that job, I found it very difficult to mentally switch off. So do you think that we can actually make a difference? Because I think, again, most of my colleagues, I would say, are always switched on. That it's very hard to get that that detachment you talked about, the psychological detachment. Are there strategies that are actually proven to work?
Yeah, I mean, there's starting to be some research that it's bringing training into the workplace, right? Sometimes it gets so bad that we need to go in there and do a training session, an intervention, to help people think about, how to actively switch off.
Yes.
And so that it's possible. The training is showing that it's effective and it's something that can help, but it is something that, people do have to, be cognizant of and consciously make that effort to switch off and say, no, I need this time for myself. This is, it's 6 o'clock or whatever it is. And I really need this time that's going to help me to recharge and reset for tomorrow.
So working with doctors and lawyers, particularly in Hong Kong, I'm aware often they say their phones are on 24 hours a day. Actually, patients will WhatsApp or they will message their doctors sort of day and night. Is it possible that there will be a culture shift in those organisations, do you think, within Hong Kong, so that people do realise they deserve that time to recover? Because to me, that feels like a really big step.
Yeah, and you raise a really good point about, cultural differences, because here in Asia, I mean, you can imagine the stress is, long before COVID-19 hit, that's been something that people have been wearing almost as a badge of honor, right? This is a culture that prides itself on working overtime. And so this is something that we really have to work with organizations from the top down to establish policies and cultures that support their people in their recovery. Some of that is around policy, but some of that is even, simpler than that is if you are a team leader or if you are someone who, has authority over a team. Role modeling recovery is so important, right? So your people have to see you, not answering emails or messages on weekends or off hours, because if you do, people will feel like, especially in Asia, right? You follow what you see. And so it's really important when working with leaders, business leaders, corporate leaders, or leaders of, teams across industries to, really get them to be aware of their own behaviors, which can help to foster these, recovery strategies that are beneficial for their people.
Yeah, absolutely. I was thinking, people say, I'm going to be on leave, but you can ring me. You're like, no, you're on leave, so I'm not going to ring you. And I think with medicine, there's always, particularly with things like surgery or other specialties where you've got that relationship with a patient, that actually you might say, well, I'm not working, but I want to know if there's a complication. So I guess the difficulty is there's always going to be, like you say, the badge of honor. I am the surgeon. I am, I am your oncologist. But you think well, and I hope, do you think recovery is worth it, right? We need to build active recovery and successful recovery into people's careers and their
Oh,
lives.
absolutely. I don't think it's even that it's worth it. It's something that's necessary,
Yeah,
right? Our bodies are not built to withstand and endure
yeah,
constant chronic stress.
yeah,
So it's something where, especially for people in the healthcare industry, you have to take care of yourself first before you can
yes,
take care of other people. So it's all the more important, right? If you are in this industry, that you are giving yourself that break.
yeah. We talk about that in our Beating Burnout workshop. We talk about the super doctor. So,
Uh,
have you fallen into
mhm.
that trap where in fact um, you sort of see yourself as indisposable, and also invulnerable to disease or burnout, but we know that isn't the case, right? And like you say, uh, put your own oxygen mask on before you try and help others is the kind of the
Yeah.
analogy we use as well. I think
Hmm.
there's so much to unpack there, and I'm really excited about your talk at the conference. One thing you're going to be covering, I understand, is something called the recovery paradox. Is that right?
Yeah. So I will cover some strategies, and I'll
Yeah,
try to stay away from kind of the obvious strategies that we all know. We need to, be exercising, we need to
yeah,
eat right, we need to be
yeah,
healthy. But I'm going to really focus on some, strategies to kind of expand our toolkit of strategies,
yes,
because I think the more that we hear, or even to see what other people are doing, that all helps ourselves,
yeah,
right? To have an expanded toolkit. So I'm going to focus on strategies that are science based, they are
great.
data backed, that have been
Yeah,
proven to be effective, that maybe are a little bit more not counterintuitive, but not the typical ones that we go to when we think about how to help ourselves.
yeah,
In reference to the paradox of recovery, this is kind of an interesting topic that's being kind of grappled with in research now, which is really in reference to this vicious cycle of
yeah,
stress, right? The idea that the people who need to recover the most, or the times when we need to recover the most, are
yeah.
actually the times when we are least able or likely to do so. And
Okay.
so you can think about, working towards a deadline.
Yeah,
You're pushing yourself so hard, and so the stress is elevated. You need to take a break, but people actually counterintuitively work even harder. They work even longer hours,
yeah.
and that makes the stress worse.
I mean, I was reading about this one of your articles, and it was really hitting home. Think about when we did our long shifts. You didn't make time for lunch, so we were always hungry. We were always slightly angry. We talk about the hungry, angry, late, and tired.
Yes. Yeah.
And I'd be
Hanger.
there trying to do a central line, so like putting in doing a delicate procedure after 12 hours on call, haven't had a drink, haven't been to the bathroom, and how on earth could I expect myself physically and mentally to be able to do anything with any kind of skill? I'm doing an epidural on a labouring woman. So I think a
Yeah.
lot of this,
Right.
we
Mm.
know that we're meant to do it, but there's that barrier, isn't there? And is it also about the healthy diet? I remember after doing night shifts, I'd go home and I'd buy myself a massive bag of sweets and a huge loaf of bread, and I would just eat like sugar.
Right.
And then obviously
Yeah.
you've got this really weird sugar high.
Yeah.
And like, oh, I should be doing some exercise. Oh, I should be, I should be eating better. But like you say, there's that almost
Yeah.
that inbuilt, it feels like a punishment. Actually, I feel like I need to treat myself. So I'm going to treat myself by eating bad food. So I'm
Yeah.
really interested in this idea. How can we break that vicious cycle where in
Yeah.
fact we're compounding our exhaustion by stressing ourselves more?
It's easier said than done, right? I mean, myself, I'm guilty of this too. I talk about, strategies, but do I do them
Yeah.
myself? No, it's hard, right? So
Well, that's being
it's
a
something
human,
that
though,
we
Bonnie,
have
isn't it?
to, yeah,
We can't expect you to be. No one's perfect.
yeah,
But I think what you said also about our team leads or even people that we look up to, it doesn't
hmm,
necessarily have to be your manager, but that
hmm,
organisational tone or what's expected within the organisation. This is how we do things here, and we expect you to have breaks. We expect you to do this. We expect you
right.
not to do this. So it sounds like there's a lot of work to be done. But it also sounds like there are things we can do as individuals to get the ball rolling, at least.
Yeah. Yeah,
Um,
exactly. And I think part of it is having these conversations, right?
yes,
Because the more we talk about it, the more we
yeah,
can, put it into practice. And
absolutely.
hopefully we can, change culture, even if it's bottom up.
Yeah. Well, exactly. Like I say, I'd be interested to hear from our participants. And obviously, there's going to be a panel during the conference. So if you've got any questions for Bonnie about this, you are very welcome to submit them. Because I'm still think that, yeah, like I say, to a lot of doctors and clinicians, the thought of actually putting time or even energy into your recovery will be something of a new concept. So I personally am going to enjoy this talk, I think, Bonnie, because I'm going to be making notes myself. I'm already making notes as we go along. One other thing you talked about, which isn't necessarily on the same theme, but at the beginning, I just wanted to ask about harnessing anxiety, I think you've said. So just asking for a friend here, anxiety in the workplace, is it always a bad thing, or actually can it be useful? Can it be constructive?
I mean, this could be its whole other podcast.
Yeah.
So short story is
Yeah.
absolutely anxiety can be harnessed.
Mm.
And that's actually the kind of theme of my overarching research has
Yeah.
been to show the positive sides of anxiety.
Mm.
All of the research shows that it's negative to the point where you've got, scholars who are publishing papers about how we need to get rid of anxiety.
Yes.
But really, my dissertation has been, and since then, my work has been about showing how anxiety can actually reap benefits at work. We all know that we need a little bit of anxiety, right, to drive our best work. A lot of people can't even, get going until there's a deadline in front of them.
Yes.
So how do we kind of take the best parts of anxiety and the motivating potential of anxiety and put that into kind of, how we address our work, how we approach our work, and ultimately affect our work outcomes?
Amazing. So in fact, and I guess they're the opposites, aren't they? You've got that, the action, the active working, the performance, and then you've got the opposite, which has to be the successful recovery, right? So I guess there's the yin and yang, if you like, but without either one, you're not going to perform best. Bonnie, that has been absolutely fascinating, and I'm going to have to stop talking to you, otherwise we're going to give away all the interesting stuff you're going to cover in the conference. But thank you so much.
Thank you. This was a pleasure.
Great. I can't wait. So we have reached the end of today's podcast. If you want to hear more from Bonnie, and why wouldn't you? So many ideas here. Please do register for the conference in the podcast description below. As I said, it's on June the 25th from 2 p.m. until 4:15, and it's free for all. Bonnie will be there, and I cannot wait to hear more about how we're going to recover more successfully. So thanks again to our guest, Dr. Bonnie Cheng. I've been Katie Grant, and we'll see you soon.